Evet, çalışmadan da bahsedeceğim. Aynı zamanda bir genel girişgah yapmak istiyorum. Hoş geldiniz.
Welcome. Thank you very much for being with us at this time of the day. It's quite early. I will be talking about endemic goiter. It might seem to be a problem of a certain region, but I think it's a global problem. As you can see in this map, it is frequently seen in the densely populated areas of the world. You can see here the India, China. This map belongs to 1889. The iodine deficiency was out there. What does it mean? 5% of the adult population and between 6 to 15 years old, higher than 10%, then it's called as the endemic goiter. What is the situation in Turkey? Rize and Eastern Black Sea region are the regions where endemic goiter is being frequently seen. And we do have thyroid specialized hospital in Rize since 1989. Why endemic goiter? The reason is clear: iodine deficiency, the amount of iodine. So it's called as the iodine deficiency. Where do we find iodine? What are the resources? Let's have a look at the iodine cycle. Iodine is naturally found in the soil, and with the effect of the river, sea, then they are evaporated, then it comes back as rain. This is, the sea, mountain, and this is Rize as well. 3,500 altitude, and this is the ice lake, the biggest ice lake of Turkey. In the iodine cyclus, in this diagram, everything is there in Rize. Then why is there iodine deficiency in Rize? What's the reason? This picture, we see them a lot. You can have 4 seasons on the same day in Rize. The floods, they can swallow the construction machinery. Between Rize and Pazar, this is the picture of flood, and every couple of months we see this. And this is the beans of Çayeli. Bean is a real source of iodine. However, the iodine goes to sea from the soil, but they lose their iodine sources because of the floods. And mıhlama is a special kind of dish of Black Sea region. Normally it's supposed to meet the need for iodine, but the animals, they do have the iodine deficiency, therefore we can't meet our iodine need from the food. You might know this again a special dish of Black Sea region. Before I moved to Rize, I just knew the name of this dish, but now I know that, and I do have a habit of that with this cabbage, dark cabbage. And what's the problem? The dark cabbage makes goiter. This is globally known. It's goitrogenic, natural goitrogenic. And thirdly, under normal conditions, fish can meet the iodine need of a person. These are the sardine fish of the Black Sea region. Black Sea has low salt levels and the fish doesn't have the appropriate amount of iodine. What is the solution? It is salt, but not this salt, this salt. As of 1968, the salt started to have a content of iodine, and in 1994 and in 1999, UNICEF and Ministry of Health started a project, and they legalized to put iodine to all salt This is without iodine. It is for the, making of some other food, but this one includes iodine. Have we seen the effects, positive effects of this action? In 2004 map, Turkey, medium level iodine deficiency. This was legalized in 1999, and of course it was not possible to see the results by 2004. But when we reach up to 2015, Turkey is no longer a country with iodine deficiency, which means that this action worked. But can there be a fourth reason? Because of the endemic goiter is seen frequently in the Black Sea region. This is Pripyat. This is in Ukraine right now. This was established This city was established on purpose. They were ready for the explosion. They were ready for a nuclear leakage. They were educated at school. And in 1986, 31 years ago, during an experiment, there was an explosion in the reactor, and this is the result. Pripyat is deserted right now for the following decades. How have we been acknowledged about that? You might have remembered that it's nuclear alarm. You need to be careful about that. Turkey is not stopping in Turkey. And the second one, the Akkuyu discussions 31 years ago was out there on the agenda. Turkey doesn't participate in international researches. The European Environmental Agency prepared this map. You see that, the radiation affects Greece, but Turkey has not been affected at all, according to this map. And you will remember Cahit Aral. He was drinking tea, but there's a speculation that he died because of cancer. And here, Çaykur, if they warned people not to drink tea, then Çaykur would go bankruptcy, so they prefer Çaykur over people. And this is the satellite images of Chernobyl explosion. Yes, correct. At the initial stages, radioactive effect went to Northern Europe or Central Europe. But after a week, it changed the direction and it started to cover Turkey. 4th of May, let's have a look at that. After 8 to 9 days, This is the situation in Turkey in terms of radioactivity. And these are the data of the Autoimmunity institution. How has Turkey been affected by Chernobyl? You see that, especially the eastern part of Black Sea region. This is Rize, Pazar, and Fındıklı. And Goiter hospital is there, and I was living here in Ardeşen. According to the politicians, the radiation, Turgut Özal, Goiter, Ercan, they used to say such sentences about radiation, and 30 years passed by. Anything changed? No. So what does radiation do? Maybe it's good for the bones. Our experience with the radiation dates back to 60, 70 years. We don't have any exposure before then. And Hiroshima and Nagasaki nuclear bomb disaster, in 15 years of researches, papillary thyroid cancer ratio is increasing, and this was proved to be related to the radiation level. Yes, it increases, but among the kids less than 10 years old, it's meaningful. The increase is meaningful. Between 10 to 20 years old, it's increasing but not meaningful. But after 20 years old, it's increasing but not meaningful. And on the 60th anniversary of Hiroshima, yes, it is related to the thyroid cancer or the other cancers, but it has nothing to do with the autoimmune diseases. And this is about Chernobyl, about the radio contamination exposure, 15th year of study. Autoimmune thyroid disease has not increased as a whole, but in the kids, anticore positivity is high. Among the population about 20 years old, no change. Between 10 to 20 years old, there is an increase, but not meaningful. But younger than 10 years old, there is a meaningful increase. So if you're exposed to the radiation at the childhood level, that risk is going to continue for the rest of your life. So can we call it Chernobyl effect? We still don't know. Autoimmune thyroid diseases. They're considered as autoimmune thyroiditis, most of them, Hashimoto thyroiditis. In Hashimoto thyroid, you don't need to have a clinical setting. Even it's thyroid, there might be some neuropsychological reflections. Hashimoto thyroiditis, this is the endemic iodine deficiency is the biggest reason. Who found it? Hashimoto found it in 1912, and along with the anticorps were discovered. Then of course the fine needle aspiration biopsy is giving you the certain diagnosis. Anti-TPO is being frequently used. Can we use it in the psychiatric diseases? Engum conducted a study with 30,000 people. In the population, 12.2% anticore positivity, and among the psychiatric patients, in depression patients, 11.6%, and there is no meaningful increase in the anxiety disorders. And he stated that they used to say there was a correlation, but I made the research with 30,000 people, so there is no correlation. But this was not conducted by the clinicians. This was a self-rated study. Oman also conducted a study. It's a prevalence study with 3,700 psychiatric patients. Again, the results were parallel with what EGNOM stated. The general population 13.7%, and among psychiatric patients it's 10%. Only the patients above 55 years old, the prevalence was 13.5%, so it was meaningful among the elderly. And case control study with 836 psychiatric diseases, ABTPO, TSH, TSH high, TSH low, and the control. And among them, the sentimental disorders, especially in the ATPO positive and TSH lower, the risk is double, and also it is high, the risk is high with the TSH. Therefore, there might not be a correlation, but along with the emotional situation disorders, then it has the correlation. And thyroid autoanticourse and the psychiatric problem correlation. I will give you some information about that. In thyroid patients with positive thyroid autoantibodies, brain perfusion anomalies, high scores on anxiety and depression. So I will be showing you some scores. And with the Hashimoto thyroiditis, depression and anxiety scores are higher, and with the symptoms, ABTPO concentration, there is a meaningful correlation. And the existence of thyroid autoantibodies, the level of depression is directly or indirectly is increased, especially among female. Thyroid autoantibodies are frequently seen, and in the bipolar disorder and also the genetic tendencies, it might be related to that. And bipolar parents, daughters, the thyroid autoantibodies are more positive. For the autoimmune thyroiditis, can be an endophenotype for the bipolar disorders. Lithium usage, it doesn't increase in the bipolar patients to see autoimmune thyroiditis, so you can use it in the clinics. But the female with autoimmune thyroiditis, hypothyroid risk can be increased. Therefore, in the bipolar patients, thyroid autoimmunity and lithium usage, they are two risk factors. And with some psychiatric diseases and autoimmune reactions, they might be resulting from the same autoimmune system. This slide is summarizing many things. The antibody positivity is seen mostly in the sentimental disorders. The atypic patients, here the symptoms are quite harsh. Perinatal, perimenopausal, old and women, and antibody positivity and subclinic hypothyroidism are more frequently observed. And among the psychiatric patients living in the Eastern Black Sea region, what is the situation? And we planned a study about that. You see the pictures of these two hospitals. The polyclinic patients were taken as the sample, and thyroid function tests and antibody levels are being checked. Then, if it is okay, we are looking for the further examination, and depending on the data we do have in our hands, 80% of the patients are female.
en fazla
There's anxiety disorder, then unipolar and bipolar depression, and as we see the red part in the red scale, the 51% anxiety disorders, OCD, and mood disorders, psychotic disorders, and others. When you see the antibodies, there is a troponin antibody 11.7%, and also BTPO2 13.3%, and there is Hiroshima and Nagasaki. There is an increase of 0 to 10 years of age, and if we classify 0 to 10 years of age, what will be the, well, we'll see where it goes when the population grow up. This is a thyroglobulin antibody high elevation, and this is 0 to 10%. You see the thyroid peroxide antibody 10 to 20 years of age, and for either one of the elevation, in cases you see 10 to 20%, and there is 46% of highness. So if it goes like this, there will be more research. When we say positive, instead of saying positive and negative, we should look at the elevations in the for example, for the 20 years of age, you see thyroglobulin and also thyroid peroxidase masses are increased. In the upcoming 6 months, we will see a clearer picture, and I would like to share the results with you in the next Congress. Thank you very much.